Hello, everybody, and welcome back to the Live Out Loud podcast. Today, we have a special guest, and it is my doctor, Dr. Bringewatt. This podcast is sponsored by Automoke Speech, Voice, and Hearing. So if you want to go ahead and tell us a little bit about yourself.
Hi, good to see you again, Kyler. I'm Dr. Bringewatt. Dr. B is easier for most people, so that's what I usually go by. Nice to be here with you this morning. I am an audiologist. I joined Automoke in about May of this year, but I've been doing this for a little over 20 years. And I'm newer to cochlear implant programming and patient care. I've certainly been working with patients who were candidates for cochlear implants throughout my career. But I'm here to talk a little bit about what I can share about it and how this has been just an amazing journey to watch you go through, Kyler.
It was, I was very pleased to have you and Dr. Salter really by my side. Y'all really helped me in the early days of it. Sharing y'all's knowledge and really guiding me in the right direction for this. So from there, I'm just very thankful from the bottom of my heart for that. And that's, one of the reasons I wanted you to come out and share your story and share what you've been able to do, because it's really inspired me in my journey as well.
Oh, that's awesome.
So my first question would be, what factors make somebody a good candidate for a cochlear implant? I know it's a pretty decent process to go through. I had to go through probably about 4 different phases of it to declare myself. So just maybe some information, some insight on what that looks like.
Yeah. So cochlear implants are really for patients who are no longer getting good benefit from a traditional hearing aid. Most people that are adults become candidates for implants after having worn hearing aids for many years, but then having a loss that progresses to a certain point where they may hear with the hearing aid, but they're not really understanding speech from it very well anymore. Your situation's a little bit more unique because you had a very sudden hearing loss from a physical trauma. And we certainly have patients that have that happen either due to a viral process or something that suddenly eliminates hearing on one side. So there are varying factors, and each patient really is going to have somewhat of a unique experience. But there is a process of evaluation for candidacy. For my past life in audiology, I've always kind of looked at the audiogram and the word recognition score. And at certain levels, when it might be appropriate to refer the patient to talk about a cochlear implant. Now I'm on the other side of it, and I've seen the evaluation. There's a lot of additional testing that is done to basically make sure that the patient can't really benefit from the hearing aid at a level that's beneficial to them anymore, because it is a surgery and it is different.
Right.
I think it is not like your normal hearing, right?
No, not at all. It definitely takes some time to get used to, and it's something definitely different that you have to learn to live with. And once you learn to live with it, it's great. It makes you unique as a person. I really appreciate that in that form, and I really, people might take it for granted, but it's honestly a really, really cool experience to go through. And I think it teaches you a lot of valuable life lessons as well.
Yeah, absolutely. And you have just such a positive approach to it. I'm wondering if you could talk just briefly about how, because I get this question from patients a lot, what will it sound like? What will it sound like? And you're fairly early on, just a few months into this journey, but you've progressed really quickly. And people will progress at different rates. So what you hear, if you would plug up your better ear and listen just through your implant, how does that compare to what you hear from your better ear?
So obviously it took a bit of time to get used to, but what I've really noticed is I can hear now somewhat decently in that ear now of the cochlear, and what I hear now is a lot of just high pitch. It's a lot easier to identify a man's voice than a woman's voice, which I found interesting in the early on stages. And I think it's just because maybe the high pitch and the lower pitch difference. But all in all, when I'm listening to music, I've referenced this a couple of times. When I'm listening to music, it sounds like I got a whole concert going on in my head. I got, the regular noise coming out of this ear that I'm used to for my whole life. And then I got something new and a high pitched voice over here sounding literally like I'm watching Alvin and the Chipmunks.
Okay. So the quality is still sound wise, the quality is still more high pitched and not the same. And you can hear that distinction.
Yes,
Yeah.
yes. But it does, after some time, it does get normal to you, I feel like, and it kind of blends in with your other hearing.
Yeah.
And kind of works together. And that's kind of the thing I saw over the past couple months is I was able to kind of shift, because it's also a mindset. Like if you're thinking so much of hearing on this side that you're so unused to it over here now that it just doesn't work. So you really have to focus your mental side on hearing in both ears with the cochlear to get it all to transpire in the correct way.
Yeah, I love how you put that. It takes work. It takes practice and going through it. It's not a very comfortable thing at first.
Right.
I think you would agree. It's foreign. It's not super comfortable at first. But I loved how when you came into the office one day, you were like, when I take my implant off now, and this was maybe after a month, it's like there's just a void over here, like a hole.
Right.
And I prefer to have it on. My brain wants that stimulation now. It knows it should have it. And your brain is still in the early stages of kind of combining what it's getting from both sides and making it all make sense. And that process can take up to a year for a lot of patients before we really see the full benefit.
Right.
But you're progressing so well and so quickly. It's just really remarkable to see.
Right. And I think that's does with, the help that I've gotten and just the work that my team has put into it. Obviously, hearing for me helps me on the mound and just helps me in an everyday life setting. So doing that to the best of my ability is what I felt was necessary to complete it. And like you said, we've seen tremendous strides over the past couple months with me, which is not possible if I'm going to sulk about something like this. I had to turn it into a positive, and that's what I think we did as a team, especially with Automoke helping me. So,
well, you've done a beautiful job of that. So yeah, we're thrilled that we get to be a part of your care team.
Thank you.
Yeah.
So the second one is, what is the most common things that we see patients go through with the cochlear?
Okay. Well, I think that there's just a big journey of even getting to that point of being ready to do it for a lot of patients. And there's a lot of information gathering and, it's a process. A lot of people are very resistant to it initially, which I understand. It's a big change. It's a surgery. But some of the common things I would say if we're talking about just after surgery and in that initial stage at activation, I've never seen anybody not be a little surprised by what they hear when we turn it on, when we actually activate the implant, which typically happens a few weeks after surgery, after there's been some healing, and the implant is under the skull, under the skin is healed and set in there. It sounds like bings, chirps, dings a lot at first, or just noise. I've heard people describe that. And so, it's normal at first for some patients to go, oh, this is not what I expected, even though we talk about it and try to prepare people, so that they know what to expect. It's thrilling to see people, though, who really haven't heard from an ear for so long start to go, oh my gosh, I could identify someone knocked on the door. I could hear the ice dropping from the ice maker. I could hear bacon frying in a pan. I haven't heard that for so long. So it's just really, it's a neat process to watch people and patients go through. What other questions do you have?
So I just want to elaborate on that. So actually I like how you brought that up because so I was without hearing in my ear for, I'd say about 5-6 months, which, compared to some others is not any kind of time. People go 2 years, 5 years, sometimes their whole life without hearing. So I saw it tremendously, like the difference it made of hearing just 5 months in. So I can't even imagine being the 5 year, the 10 year area and being able to hear. Like, it's something so incredible. Like, it took me a step back where I was like, wow, like I can hear again. And
Yeah.
I was only without it for 5 months, and I was with it for 21 years.
Yeah.
So it's amazing how that works. But yeah, I just wanted to touch on that.
Yeah.
But the third one is, how has the technology of the cochlear kind of evolved over the recent years? I've done some research on it, obviously, when I was a candidate
Yeah.
for it. And I saw just the difference of, the looks of it, how it's used now, all the other parts that are connected with it now. Like, I have a microphone that my coach puts on his
Yeah.
shirt, and I'm able to hear him talk while I'm on the mound. So, like, just how has that kind of evolved into maybe making it more comfortable for us?
Oh, yeah. I mean, just like with hearing aid technology I've been an audiologist for 21 years. So in the early 2000s, when I was finishing up initially my master's program before my doctorate, we probably would not have recommended you for an implant back then.
Mm-hmm.
If a patient had a unilateral one-sided hearing loss, but they still heard from their other ear, or their other ear was stimulable with a hearing aid, the recommendation at that point in time was really not to do an implant. And the thing that I used to hear from the doctors that were teaching me and the surgeons that I worked with was, it's never gonna work. Like, because you have quote unquote normal hearing on one side, you're just never gonna accept it. Your brain's not gonna get used to it. But back then the technology was not where it is, obviously, just like if you think about your cell phone and what's happened in 20 years, medical technology advances as well. And cochlear implants is certainly something that's advanced. So there are different points of stimulation that the implant has to the cochlea, to the auditory nerve. And if you think of a Tinker Toy piano, like one of those little pianos that you would give to a child to play on, I guess one analogy is the implants 20, 25 years ago, that's what they had to work with. That was the sound capability. And now it's more like a grand piano. So the sound quality is much better. And this is why it works with people like yourself who have a unilateral profound hearing loss and can still hear from the other ear.
Right.
Yeah.
So I just touching on it. I saw the first cochlear that was done. I don't remember the exact year, but it was by a doctor, and he did 2 young kids, and I think one was like 5 and one was like 9. And I was looking at the photo of it, and it's like there's a long string attached to it, and it goes like way down. It's not just something that just clips right here.
Yeah.
It was a lot bigger of a device and probably had a little more complications, which I've kind of developed to see, like, that's pretty cool to see how it's really evolved over these recent years into where I've been able to get mine in, how I've been able to switch out the pieces or put my aqua piece on when I'm playing baseball, like that kind of stuff. And it's just amazing to see that.
Yeah, you're absolutely right. I mean, the battery pack for the implant used to be a whole separate pack, and there was a cord that went up, and the device itself was much larger. The surgery was longer and more, we've improved the surgical technique as everything's gotten smaller too over the years. And I'm wondering if you would just take your device off for a minute and maybe show people, because I know it's on the other side, but yeah, this is a cochlear implant. And, compared to having the equipment we used to have, it looks pretty cool. And I like you've got your aqua coil on, I think. There,
I got I got a little routine that goes down now with it. Obviously, I'll take this piece off here, slip my aqua piece on, put it on my head for baseball, and then just keep this part because it's the same thing. It gives me a little color to my life too, if you think,
I know. So, I like it. I like the color.
But,
and the aqua piece, the aqua sleeve he's talking about, allows when you're outside and sweating playing baseball in Houston, Texas, as you do every day.
Every day.
Yeah. Obviously, electronics are susceptible to moisture problems, but this makes the device moisture proof, waterproof. You can swim in your cochlear implant, which I think is awesome.
Oh yeah.
Yeah, and it's game changing for a lot of our hearing impaired patients. I'm just thinking of a patient I saw recently who's had a profound hearing loss since she was identified when she was about 2, and she's worn very powerful hearing aids her whole life. She's a mother of 4 young children, a remarkable person, but she's got limited benefit from hearing aids. And we were just talking about the pros and the cons of making that next step to implantation. But like one thing for her would be, yeah, you could get in the pool with your kids and you wouldn't have to worry about getting your ear wet, like you would hear from it. So yeah, the technology is amazing. I love seeing little kids at the beach down here with their aqua sleeves and their implants, and they're splashing in the water and their parents are talking to them. And it's like, yeah, that's something they wouldn't have been able to do a long time ago.
Yeah. And it's also great because, when you take your cochlear off, for those who don't know, your balance is affected when you lose hearing. So my balance was truly affected this year. So, when I don't have my cochlear off, I'm kind of off balance. It takes me a bit to kind of get used to. So, having that cochlear, the aqua sleeve, or just having the cochlear in general on to do those kinds of activities like swimming, baseball, anything like that, it really helps in terms of performance and just all of the other minor stuff that goes into a cochlear implant.
Yeah, that's awesome to hear. I'm glad. So you feel like it not only gave you back your hearing, but improved your sense of balance.
Yes, absolutely. Yeah. I mean, I wish I had a video, pull up and show y'all. But last year I'd fall off the mound when I'm pitching.
Oh, wow.
Not because I'm not able to balance going down the slope. And this year I'm able to hold my balance perfectly fine, probably better than I did before. So that's just something really cool to me that I have seen in terms of the cochlear. But another question I'd like to ask is, what misconceptions do people have about cochlears? I know some of it is a little uncharted still, so just what do people usually think might go into it, and what is actually going into it?
Okay, that's a great question too. I think that there is a lot more education that can happen around cochlear implants, and that's what we're seeking to do here too with this podcast.
Yes.
Is just get some more information out there for people. I think there's some misconception that, it'll be like a hearing aid or it'll sound like that. And it doesn't. It does sound different, but the brain over time, and it does take time, learns to interpret the signal that it's getting and basically translate it into meaningful speech information. I think there's some misconception too, as I've talked to patients over the years that I'll get the implant and then you turn it on and then I just hear. And it's unfortunately, it's more of a process than that. It does take time, and patients have to do some work at home. They have to do some practice with the implant to learn to understand what they're hearing with it. So it is a process. And we try to always educate our patients and explain, you're going to get out of it what you put into it. It will take daily effort on your part to wear it and to learn to listen with it. I think there's also some misconception just about how cumbersome it might be, the device might be, or some fear about the surgery. I hear that from patients too. The surgery has become shorter over time and less invasive. I mean, it's a surgery, but how long did it take you after surgery before you were kind of pain-free and feeling sort of healed?
Sort of healed. So I actually, usually for those who don't know, there's dizziness usually that is
some people do
used
experience
within that. It
not
depends
everyone.
it depends on the people. I was very blessed with only having a headache. So I did have a headache for about a day. The day surgery happened, obviously they just drilled into my head. Normal. And I'd say from there it took about a week to feel completely normal again. I was just very tight in my neck and head area. And I was very scared to make any sudden moves for that week. So it was kind of a mind over matter thing more than actually pain thing, which I think is the biggest deal is kind of your mind is, I'm okay, I'm fine, this is something that's going to help me, I'm not hurt, like I just need to go about my daily activities, because they told me 2 to 3 days before you can start doing your daily activities again. So I tried. I tossed the baseball a little bit, did what I could. But the scares of having that in your head is, I think, the biggest thing that affected me.
Yeah,
So
that's a good way to put it. Having something in your head. I hear patients say that too. It's like, they're going to do what? That goes in my head. And it's like, yes, that is what happens. Does it, you're what, 3 months out now?
yes.
Do you feel like there's anything strange about having that in your head now? I'm just curious. Like,
there's a funny side of it. So if I take my cochlear off and I shook my head, you can hear the metal rattle.
oh, okay.
Which to me, that's funny. My wife doesn't think it's funny. She thinks it's kind of disgusting. I'm gonna put that out there. But I think it's hilarious.
Interesting.
But other than that, I feel fine. I have 3 screws in my shoulder as well, so
Okay.
sometimes that will affect my throwing, just because I have knots in my shoulder and it'll run up to my neck, so my neck will be a little bit tighter now than it used to be, just because there is all that stuff in there now. But other than that, I feel completely normal.
Yeah.
I feel just like I did before, better,
Yeah.
because I'm able to walk in a straight line now.
Yeah.
So
yeah. And you're just a few months out,
Right,
So
right.
that's great. I mean, I think the healing process usually for patients is quicker than they think it's going to be, as far as the physical healing from the implant. And we have lots of patients that are much older than you. Although he was saying, I feel so old. I'm like, oh, don't say that. That go through this surgery, and yes, they're back up in a couple days, and they're doing all their normal activities, and they do very well with it.
Yeah, it's it's one of those things where if you let the circumstances control you, then there's not going to be anything to look forward to. But if you control everything and you control the situation and you define it yourself, then I think that the ceiling is, not even in sight. You can go as far as you want with a cochlear. And
Right.
that's kind of was my goal with this, is turning something that might have happened to me into something positive, influential, and knowledgeable for those out there who need it.
Yeah,
And,
absolutely.
that's what you're doing. That's what Autumn Oak's doing. So I really appreciate that. And I appreciate what y'all done with y'all's knowledge in that department. So, but we're coming up on the end of this this podcast. So do you have anything you would like to say to the people watching, or any inspiration, anything of that kind of way?
Well, I'm just happy for anybody that is tuning in and watching and listening to Kyler talk about his journey with cochlear implants. If this spurs you to have some questions, reach out to us. I think you'll find our information in the comments section. So, reach out. We're happy to answer questions. Cochlear Americas, which is there are multiple manufacturers, but that is what Kyler was implanted with. They also have a great support network we can help plug you into if you have questions. So we're just excited for anybody who's tuning in and getting a little more information and hearing about Kyler's journey. And we'd love to answer any questions that you have.
Yeah, absolutely. We're here to help in any possible way, whether that's the mental side, the cochlear side, the regular hearing aid side, anything of that kind. We're here to help and, grow this community and show them that, you're not alone. You have a team, you have a family. So, once again, I appreciate you coming out and helping with this. I think what you said today was very helpful, and it will help all these people grow within the community. So I really appreciate that.
Well, thank you. We appreciate you.
This holiday season, thousands of Texans are facing the possibility of losing their SNAP benefits just as the holidays approach. Many families in our community could go without food they need during this crucial time. You can make a meaningful impact by donating non-perishable food items at our speech location, 820 South Friendswood Drive, Suite 100, before November 24th. Your generosity could be what puts food on a family's table this holiday season. Please, guys, please, let's stand together to support our neighbors in need. Every donation matters. Here are a few of the organizations that we'll be donating to. The Clear Lake Food Pantry in Houston, Texas. Christian Helping Hands in Pearland, Texas. M.I. Lewis Social Service Center in Dickinson, Texas. Guys, this is really important. I really hope that y'all would consider, as we can really make an impact in families' lives and really help them out over this holiday season, because that's what the holidays is about. It's about giving back and really helping everybody else. This podcast was sponsored by Autumn Oak Speech, Voice, and Hearing. My name is Kyler Menzel. Thank you for joining Live Out Loud, and always trust God and live out loud.